Welcome to Sports Doctor. Sports Doctor is a live presentation, so we encourage you to call into the show and ask your questions on injury, rehab, training, or technique. We'll be taking your calls shortly. Call 767-8884 for your direct line to Sports Doctor. Here's your host for tonight's program, medical reporter Joe Chapana.
Hey, good evening, and thank you for joining us for another edition of Sports Doctor, brought to you by Cross Keys Physical Therapy Sports Medicine Center in Sicklerville, Woodbury, and Berlin, and coming soon to Washington Township. In fact, that new location will be opening June 10th. I'm Joe Chapana. We're here every other Thursday night at 9, helping you get back into your game and get on with your life after your sports-related injury. We are be taking some questions from you a little bit later on tonight as we talk about the shoulder. Shoulder problems will be our topic for this edition of Sports Doctor. To answer your questions about problems you're experiencing with your shoulder, we have Dr. Anthony Valarie, who is an orthopedic surgeon with Tri-County Orthopedics in Washington Township and Woodbury, and to his right, Dave Anselmo, who is a physical therapist with Cross Keys Physical Therapy Sports Medicine Center. Welcome to the program, gentlemen. And Dave, we'll start with you.
Sure.
Give us an anatomy lesson on the shoulder.
A brief anatomy. This is the right shoulder. This is the collarbone right here, better known as clavicle. This is the scapula. It's right here, better known as a wing bone. Okay, as we come up here, acromion process, coracoid process right here. This is the humerus. This is inside here. There's a glenoid fossa where the humeral head sits on. Let's go around here. Go back in. Some of the musculature right here is the supraspinatus. It's a big popular one we see come through here. Subscapularis, which comes here and attaches in here. If I turn it around, infraspinatus, which comes around here and attaches in here. And basically, the shoulder joint moves in many different directions. So that's the basic anatomy of the shoulder.
And some of the topics we're going to be hitting on tonight, of course, rotator cuff problems, detached labrums, labrum tears, impingement syndrome, and of course your questions too. So if you are having problems with your shoulder joint and you'd like to talk about it, our number is 1-888-634-7488. Locally, 856-767-8884. And I'm also going to give you our email address. If you'd like to email your question to us, we'll be happy to take that as well. It is wpsjtv@aol.com. Again, Dr. Valarie with us, also Dave Anselmo. Let's start right with impingement syndrome, Dr. Valarie. What actually is that?
Well, impingement syndrome is probably one of the most common problems people have with the shoulder in terms of pain. And generally, which camera I had there, if we go back to the shoulder model here, we have the shelf of bone right here, which was the acromion, and the humeral head. I don't know if you can zoom in, but every time we reach overhead, whether it's in our job or just in everyday life, we notice these are the rotator cuff tendons in here, and when we reach overhead or bring our arms away, that bone comes very close to the acromion. It pinches off the tendon. And actually in that space is also a bursa, which is a cushiony sac, which gets inflamed and people get bursitis from it. So they get a condition of bursitis, tendinitis, lumped together. The condition is called impingement syndrome.
And basically the symptoms would be what? A soreness here? Or?
Soreness over the top of the shoulder, possibly the front of the shoulder, but more specifically it's pain if a patient is either reaching forward, reaching away, or reaching overhead.
What treatment options are available for people with this?
Well, the first thing we do is physical therapy is always going to be the first line of treatment with it, as long as we've isolated the injury out and made sure it's not some other tendon tear or what have you. What helps control and stabilize the shoulder are the rotator cuff tendons and muscles, like Dave just identified before. They help to stabilize the head of the humerus, which is the ball and socket joint, and it helps to hold that in the socket. When you have laxity or slight deconditioning of those rotator cuff muscles and tendons, that's going to lead to greater motion in the shoulder, and that's going to mean that the head will ride up, pinch against the bone, cause pain.
And before we go on, let me mention that Cross Keys Physical Therapy Sports Medicine Center is offering free evaluations for the next 2 weeks. If you're having problems with your shoulder, experiencing some pain, you'd like someone to look at it, you can take advantage of this free offer. We'll give you the numbers at the end of the program to schedule an appointment. Right now, though, our toll-free number for just questions about your shoulder, 1-888-634-7488. Locally, 856-767-8884, and our email address is wpsjtv@aol.com. Now, Dave, as a physical therapist, what type of treatment do you offer to those with this impingement syndrome?
Well, a lot of times, as Dr. Valarie said, the impingement comes up in here, and it's because it can compress in here. So therefore, we see a lot of people come in and it's inflamed a lot in here. So what we do is we put general heat on the area, electrical stim to try to increase the blood flow into the area, to try to move out some of that inflammation and try to decrease some of their pain. We followed up with something called ultrasound, or what we call phonophoresis, which is a 10% hydrocortisone cream which we rub over the area and we push it in by using the ultrasound, which is a high frequency sound waves, which pushes the medication into the area. Sometimes patients really don't like injections or something like this, so that's an option of those. It's not really as good as an injection, but it's an option for them, and maybe it's not as inflamed as it needs to be. So that's one of the other options we use. Also, we use something called joint mobilization, where we are doing a manual distraction of the joint to try to increase the space in here, and followed it up with doing strengthening exercises. That not to explain, strengthening is probably the most important because we want to get stability of the shoulder joint and get away from that play.
Okay, shoulder problems is what we're talking about. If you have questions about your shoulder, 1-888-634-7488. On the line with us is Robert. Robert, are you there?
Yes.
Robert, thank you for watching. Where are you calling from?
From Plumstead, New Jersey.
Welcome to the program. Your question about the shoulder.
Recently, I had an X-ray on my shoulder, and I have a crooked bone right on my shoulder blade, and I'm wondering what could could cause that, and what is the possibilities of fixing it?
What type of bone was that? I'm sorry.
It's right on my shoulder blade.
It's crooked, you said?
Yeah, it's like almost as if you took a stick and bent it, and I have like a protrusion right up near my shoulder.
What would cause something like that?
Well, I'll probably answer that. Sometimes, now I don't know where it is in the shoulder blade, if it's out by the shoulder or if it's more towards the flat part of the shoulder blade. First thing I would think of is either it's just something congenital, meaning you were just born with it and it's something normal that's in your body. The other might be an injury. Either you got hit in the back, specifically right over that area, whether it was, it could be a baseball, whatever. And from that injury, your body is just a defense mechanism, a way of healing, just formed a little spur of bone. I'd really have to look at an X-ray to see exactly where it is to kind of give you a better idea as to why you would have had it.
Well, we appreciate you watching. We thank you for the call, Robert. Let's move on to Sewell. Christine, are you there?
Yes, I am.
Thank you for watching Sports Doctor. We're talking about the shoulder tonight. What's going on with yours?
I have a question for you. I've had shoulder problems, and the only thing that seems to work for me is an injection. And I wanted to know how safe it is or how often you can get an injection without it causing problems to that area.
What type of an injection is it?
To numb it up and also the anti-inflammatory.
Yeah.
Okay.
Probably a cortisone injection, right?
Actually, it's not cortisone?
Yeah, it's, well, that's one of the way of treating it, and I guess I didn't follow up on that. When you have the condition of any inflammation, whether it's tendon or bursa, it's simply inflammation. Anti-inflammatories, the ultrasound like Dave described, you want to help get rid of it. If it doesn't help, we can do cortisone injections. Now you can do cortisone injections in several different areas of the shoulder. One of the most common areas is in that subacromial space how you get impingement syndrome. The cortisone is relatively safe, as long as you're not allergic to it. And you want to space those out obviously as far as you can. The safe zone would be somewhere around 3 months, probably better the 4 months. Now, if someone were to come into my office and they came a couple times, 4 or 6 months apart, I have no problem injecting them as long as it was going to give them some long-term benefit and as long as they followed up with some kind of exercise and at least took care of the shoulder afterwards. But if you just set your calendar that every 4 months you're going to see the doctor for an injection, it just keeps repetitive nature of injections. you should probably try something a little bit more aggressive, maybe even consider surgery for it.
Christine, thank you for watching and thank you for the call. Again, we'll have numbers at the end of the program if you'd like to take advantage of the free shoulder evaluation offer from Cross Keys Physical Therapy Sports Medicine Center in Sicklerville, Woodbury, and Berlin, coming soon to Washington Township. We're talking about problems of the shoulder tonight. If you'd like to ask a question about yours, we're going to get to rotator cuff problems, also labral tears. We've been touching on impingement syndrome, and also your questions too. 1-888-634-7488. Email WPSJTV@AOL.com. More of Sports Doctor right after this.
Hi, I'm Kevin Ross from the Kansas City Chiefs. When I need physical therapy, I chose Cross Keys Physical Therapy, one of the leading rehab centers in South Jersey.
Cross Keys Physical Therapy offers aquatic therapy programs that will help you strengthen weak muscles and improve your flexibility. Our highly skilled physical and occupational therapists are experienced with working with athletes and non-athletes alike. So if you need to get back to work or back to play,
Cross Keys Physical Therapy. Sicklerville, Woodbury, and Berlin.
You were always there for me, pushing me and guiding me, always to succeed. You showed me everything that I should know. You showed me just how to walk.
Appreciation. Pass it on.
'Cause Mom, you always were the perfect
A message from the Foundation for a Better Life.
Okay, we're back. We are live. We're talking about shoulder problems tonight. You are watching Sports Doctor. It's brought to you by Cross Keys Physical Therapy Sports Medicine Center, Sicklerville, Woodbury, and Berlin. Coming soon to Washington Township, June 10th. And if you'd like to take advantage of the free shoulder evaluation offer, we'll give you numbers at the end of the program to call the individual center that's closest to you. In the meantime, you've got some problems with your shoulder. You'd like to ask a question. Toll free, you can do it at 1-888-634-7488 locally. 856-767-8884. Our email address is WPSJTV@AOL.com. We're with Dr. Anthony Valarie, a board-certified orthopedic surgeon from Tri-County Orthopedics in Washington Township and Woodbury, and also Dave Anselmo from Cross Keys Physical Therapy. He is a physical therapist. We're back on the phone lines. We're going to Laurel Springs, and it's Jared. Jared, welcome to the program. Your question about the shoulder. Hello, Jared, are you there? Should we give him a couple of minutes, or no, we'll come back to him, I guess. Why don't we talk about labral tears? What exactly are those, Dr. Valarie?
Well, the labrum, let's back up a step. The shoulder joint is a ball and socket joint. The socket is a very shallow socket, so to help give it a little bit more surface area and stability, there's a thick fibrous ring that's attached to the bone of the glenoid that's called the labrum. And it does help with stabilize the ball in the joint, so when we throw, move, pick, reach overhead, whatever with our arm, it helps to keep the ball or the humeral head in the socket so it doesn't shift forward, shift back. Now, with certain injuries, whether it's a football injury, whether it's something repetitive, or you lift something too heavy, you can create a tear in that labrum where that fibrous ring tears away from the bone. Sometimes it does not need any aggressive intervention or even to be addressed. It depends on the patient's activity level, but a lot of times it can cause instability, it can cause pain because people are stressing the shoulder. And because of that, labral tears are one of those things in the shoulders or in the body that don't generally heal on their own, and they need a little help from us. So that's when we usually recommend surgery for that.
Let's talk about some of the treatments for that, but first let's go back to the phone lines, and from Pemberton. Tom, are you there?
Yes, I am.
Hi, welcome to Sports Doctor. We're talking about the shoulder tonight. What's your question?
Well, number one, I've had shoulder surgery on my left shoulder. I had impingement, and I did 5 weeks of PT prior to the surgery. And the PT got me so far, but the pain that I had was not going away. I couldn't sleep anymore, couldn't lift the arm up, and physical therapy just wasn't doing it. So we did open the shoulder up and we didn't do arthroscopic. We did cut across the top of the shoulder. We lifted the clavicle, and underneath the clavicle were some spurs, but they took the spurs off, and then basically
okay, we're
about a half-inch off.
We're running out of time, Tom. Can you ask your question, please?
I'm sorry, I can't hear you.
We need your question. We're running out of time.
Oh, I'm sorry. The question is, I was told, well, I'm about 4 months after the surgery, and I'm having a little bit of difficulty reaching forward. And I just wonder, up and down is doing pretty good, but forward is a difficult thing. So I was just wondering what I could do to, maybe exercise the forward motion.
Okay, is that a normal concern? Is it? Do you see this?
Well,
a
he
lot?
says he's having difficulties with it. What is he having? Is he having pain with it, or is he having problems with the range of motion? What kind of difficulty are you having?
It's mainly pain when I reach straight forward.
Okay. Well, I mean, I could help out with something, and maybe you could just jump in and help. Maybe you might have a little bit of instability in the shoulder joint. We know when the shoulder joint, when you move the shoulder joint, if you really don't have good stability of the shoulder joint, the humerus itself will move to the area of the weakness. So it's a possibility when you're leaning forward, it could be the humerus is moving backwards because you might have a weakness in the posterior part of your shoulder joint, or maybe even inferiorly. So you might really want to get looked at as far as really getting some good stabilization exercises at the posterior part of the shoulder joint to maybe help to stabilize you a little bit better. I don't know. That's one of my first thoughts.
Yeah, one of the things you were talking about was they had to open the shoulder up for the impingement. Well, generally we don't usually do that. Usually it's all done arthroscopically. You said they took the end of your clavicle off. That's different than impingement. It's a whole different thing altogether. I'm assuming what you're talking about is the acromioclavicular joint. If they took that out, now generally you take it out if it's worn out, degenerative changes. You take it out. Sometimes patients can expect to have some weakness with it, depending on their activity level. A lot of times they don't even notice a difference. The strength comes back. It would really depend on when you said they opened your shoulder up, where they actually opened the shoulder up, because your deltoid muscle attaches there. And if they did an impingement surgery like you talk about, they would have to take the deltoid off the bone and then reattach it. One of my first thoughts is, the deltoid may not have healed back correctly, may still be weak from the surgery, and that's what's giving you the weakness forward and some of the instability. But it depends on where the incision is.
Okay, thank you for the call. Thank you for watching. Again, we will have that number at the end of the program if you'd like to take advantage of the free evaluation offer from Cross Keys Physical Therapy. You're watching Sports Doctor. We're talking about the shoulder. We were just talking about labral tears, and you'd mentioned surgery as an option, Dr. Valarie. What do you do as a surgeon with that? What's that like?
I was saying earlier, the way we need to do it is to basically reattach. Since the labrum is torn away from the bone, we need to reattach it there. We don't have the technology now to sort of spot weld it back to the bone, so the best thing we can do is through an arthroscopic procedure, which is just 2 or 3 small holes in the shoulder with special instruments and whatnot. We have generally anchor the labrum back to the bone. That's pretty much the most we can do. We either suture it down, or there's little pegs and washers that we can put it down there with that are absorbable in time. But all it's meant to do is hold the labrum against the bone until the patient's own body can heal the labrum back to the bone.
Will the tear actually repair itself in time, or is that something that's always going to be torn?
No, it'll heal itself in time.
It will. Okay. Let's move on and talk about physical therapist, the role with treating a person with shoulder instability. What do you do, Dave, as a physical therapist to help someone with this?
Well, first of all, I think a very good physical examination really is helpful to find out where the weaknesses are. Because one thing we find when you evaluate somebody, there's usually a tightness or one area that is causing a problem in the shoulder joint. For example, a lot of times you see people come in with a lot of tightness in the front of the shoulder joint, and they're really weak in the back or the outside. So really what we do, we'll go through and evaluate the patient, work on stretching the area that's really tight and strengthening the whole area. You really want to have a good balance in the shoulder joint itself. So you don't want to have one area overpowering the other.
What would cause one area to be stronger, I guess, than the other?
Well, you see people in the gym, very common, doing a lot of bench presses, doing a lot of forward activities, flies and stuff like that, working on this pectoralis muscle right here, which is on the front of the muscles, but not working on anything in the back of the shoulder joint, which is going to cause increased stress on the front and a little bit of weakness in the back.
Okay, back to the phone lines we go. You're watching Sports Doctor. We're talking about shoulder problems. Our next caller is named Milton. Milton, are you there?
Yeah, I'm here. I've been working out on my shoulders, and I do like kickboxing and stuff like that. And I have, after I work out on my shoulders, I have like a burning sensation on the back of my shoulder, in between my neck and my shoulder blade, on the very top. I mean, I don't know what the burning sensation is, but it's worse than like soreness.
Is that something for Milton to be concerned about?
Well, I mean, does it continue to burn after you're done, or for how long of a period of time does it do that?
Well, the very next day, it's like a burning sensation. It's like more than just muscle soreness, because I can barely move my neck and stuff like that. And I was wondering, did I injure something back there that it could
you might have a lot of tightness back in that area, and the musculature or the soft tissue is rubbing against the back part of the bone and causing some inflammation to occur, and that's why you're feeling some burning and some in that area the next day. It's something to be concerned about, obviously, so you really should go in and see somebody about it. You might just need to be stretched and get a real good massage back there and loosen that area up and making sure you have good balance in the shoulder joint itself, because if not, it could definitely cause further problems down the road.
Milton, thank you for watching. Thank you for the call. Again, we'll give you the numbers at the end of the program if you'd like to take advantage of the free evaluation offer from Cross Keys Physical Therapy. Back to the phone lines, this time to Camden. Deborah, are you there?
Yes.
Hi, thank you for watching. We're talking about the shoulder tonight. How was yours?
Oh, it's not too good.
Uh-oh.
I had rotator cuff surgery a couple of years ago, and now I have re-injured the shoulder. And they're saying that I don't need surgery. Will the shoulder ever be right again? Because there's a lot of things that I can't do with the shoulder now because it stays in pain a lot. I've had cortisone treatments. I've had a lot of therapy, and it still bothers me a lot.
And it's torn?
It's not torn now. I had it operated on, but then I re-injured it after I had it operated on.
Oh, okay. Well, if you've had it, if you had surgery on it before, it's repaired. You did well after the repair. The MRI, I assume, confirmed that it wasn't torn again. Then I would probably put you through the same stuff: the therapy, the medication, the injections, to see if we can get rid of it. The absolute last thing you want to do is go in there again. If you had the rotator cuff surgery the first time, some bone is probably cleared away and the tendon repaired and the bursa taken out. Now, if it's hurting you again and the pain isn't relieved, you might need to have arthroscopic surgery, maybe not necessarily an open one, but an arthroscopic procedure to help maybe clear out some of that thickened, hypertrophic and scarred up bursa to give the shoulder more room.
Okay, back to the phone lines we go. Johnson from Ariel. Johnson, are you there? Oh, John, I'm sorry. John, are you there? Hello? Yes, John. Welcome to Sports Doctor. How are you tonight?
I got a question. 2 days ago, I was lifting a filing cabinet, and I felt a little pop in my shoulder, and then it hurt pretty much. And for 2 days, I can't lift my arm outward. The weight of my arm actually, I just can't pick that up, but I can push it straight out.
I hear Dr. Valarie groaning. Why are you groaning?
The top two things that come into my mind is you either have a labral tear or a special kind of a labral tear called a slap lesion, or you have a rotator cuff tear. More possibly, you say you can't lift your shoulder up. You probably have a rotator cuff tear. Sometimes you want to let the dust settle on this thing. You might have some inflammation, let it settle down. But usually when patients present with a history of they lift something way too heavy, they hear a pop, they can't move their shoulder, my money goes towards like a rotator cuff tear.
Okay, thank you for watching. Back to the phone lines we go to Mount Laurel. Is it Bernie? Bernie, welcome to Sports Doctor. Go right ahead with your question.
Thank you very much. Yeah, I'm calling on behalf of my daughter. She's 12 and a half, and she is now pitching softball windmill pitch. And lately she's been complaining about a lot of discomfort in her shoulder, and apparently it's radiating up to her neck. Now, we do stretching before, and also, obviously, she warms up. Is there anything else you can possibly, any tips you can give us?
Well, I mean, you say warming up. I don't know what kind of warm-ups are you doing for her.
Well, I'm warming up in addition to like the basic stretches, where she holds her elbow and and behind her back as well. Warm-ups basically, we're just starting out slow overhand pitching, and then we work into the slow underhand and the windmill, and then obviously when she starts pitching, then she's going a little bit more full, blown.
Right, now she is pitching. You said she's 12. Are they limiting how many innings she's pitching? Just like
yeah. You can only I think pitch 4 innings a game.
Is it
max? And during the week, I believe it's 8 or so.
It's the windmill.
It's underhand, right?
Underhand, yeah, windmill.
It's the windmill.
Right. Well, it sounds like you're doing all the right things. I recommend you to come in for evaluation. Just let us take a look at it. Maybe she has a little bit of a imbalance there in the musculature there. It's really hard to detect over the TV, but I would recommend you to come in and take a look at it.
And we're going to give you those numbers too in just a little bit, so hang on for those, okay? Let's go back to the phone lines to Atlantic County. John, are you there?
Yes, hi, I'm here.
Thank you for watching. We're talking about the shoulder tonight. What can we do for you?
Several years ago, I was diagnosed as tearing my tendon from my rotor cuff ligament. Is the doctor that did the diagnosis indicated that it was, in other words, the whole thing was let go for a number of years, and he indicated that if he operated, and he could, I would lose 50% of the use of the arm. Would that be true?
50%?
Well, I don't know if that's necessarily true. There's a lot. Just to sort of talk generally for a minute, when someone has a rotator cuff tear, you have to take into account the patient's age, patient's activity level, the demands they place on their shoulder. They have to place on their shoulder every day. The arbitrary number we usually pick is about 60, 65 because people usually retire at that age. But if you have a tear, and it's an old tear, if you have an old tear, chances are it's probably not repairable, and chances are it's probably a really big tear. You can do surgery to kind of clean up the shoulder, take out the bursa, trim back the tough edge of the tendon, but you might lose some strength, but with therapy, you should be able to at least get back a lot of the motion.
And we'll have to cut it off right there, Dr. Valarie. Unfortunately, we're out of time. I do want to put the numbers up on the screen. We've been talking about the free evaluation offer from Cross Keys Physical Therapy. There are the numbers. In Sicklerville, 728-1900, Woodbury, 719-8111, in Woodbury, 853-0988. Pick the center closest to you. Make an appointment before you do. Check out their website, too, if you need more information. And also keep in mind their center is open in Washington Township on June 10th. I want to thank Dr. Valarie for joining us again with Tri-County Orthopedics in Washington Township and Woodbury. And Dave, nice to have you here as well. Until next time, our next program 2 weeks from tonight, we're talking about the back next time with Dr. Stephen Valentino. For Sports Doctor, I'm Joe Chapana. Stay well.